What we're going to talk about now is something I think is really cool, and it's a little trick that I think you can all take back to your shops tomorrow and start using. And this is what I call the Swiss Army knife of vascular access. And what I'm talking about here is something known as a micropuncture kit. Now, you may not know it, but you all have this little kit at your hospital. Almost every hospital does. It is a vascular access kit that, if nowhere else, will be in your cath lab in the hospital. But you will be able to find these if you go down to Central Supply, and often you can ask them to start stocking them in the emergency department. And I will tell you, this kit is priceless and can be used in so many ways when you are attempting to get vascular access. So what is it and how do you use it? So vascular access, essentially central lines and putting in arterial lines. We use the Seldinger technique almost exclusively, or the idea of capturing the vessel with a needle, threading a wire into it, and now you've caught the vessel with a wire, and over that you thread a catheter, right? That's essentially how we're putting in most of our central lines and arterial lines. And mostly the way we do it, or the equipment we use, is guided by the central line kit that we have. And it can get the job done, but it's not always the best tool for the job. And so your needle is obviously guided by the kit that you have, but more often than not, it's a large 18 gauge needle that's somewhat clunky. And I think we've all had the experience that when we're poking at the vessel, we almost have to joust in it to get through that anterior wall. Additionally, you come into troubles when you have these vessels that are collapsing on you, and it's really hard to get inside that vessel with a needle this big. You also almost always have a J-tip wire. And the idea of a J-tip wire is since the wire curls like that, when it gets in the vessel, it won't go through the vessel wall. It'll be blunt. And most of the time in large vessels, this works just fine. But when you get a smaller vessel or a vessel that's collapsing on you a lot, it sometimes can be very hard to thread a J-tip wire, and it'll kink and get stuck. And it becomes somewhat of an issue, right? A micropuncture kit is going to get us past that. So let's take a look at it. So this is our micropuncture kit. Let's look what we have inside it. You essentially have three things. It's fairly simple. You have a small 21 gauge needle, so much smaller than your 18 gauge. You have an introducer sheath, and this can either be a 4 or a 5 French introducer sheath. And you have a straight tip wire. Now, all three of these things together can be used very successfully to place all your vascular access tools. And all you have to do is bring this kit along with what other kit you are using to put in either your central line or your arterial line. So let's look at them in particular. This is your 18 gauge that typically comes in your normal kit, 21 gauge, which is your micropuncture. And again, one of the things that makes this so nice is because it's such a smaller gauge needle, you really don't have to joust with the vessel wall. It really just slides in there. So it's a much smoother insertion. Additionally, it's a much smaller needle. So as you're poking around, you do much less damage if you do happen to hit something you don't want to. But also, it is a beautiful needle that shows up quite well on ultrasound. And so you can work yourself into much smaller spaces. And so you can see here as this micropuncture needle is coming in to your IJ, you've come in from a lateral approach, so you can see the whole needle. This IJ is collapsing and getting really small, but you can see the whole needle in it. And even while it's collapsing, you can just walk yourself through that anterior wall. It really, without all that jousting, you can stay fairly steady. And then you've got your artery behind it here. And so it becomes much easier to get into tight spaces when it's not a giant IJ that's sitting right in front of you 1 centimeter below the surface of the skin. All right, now let's look at your introducer sheath. This is either a 4 or a 5 French introducer sheath. It's got a built-in dilator, so you don't have to nick before you go in with this. You can simply just push it in and go all the way in with it. And what this allows you to do is once you've captured the vessel with your introducer sheath, you can now take the top off it and you're in the vessel. This will fit a normal wire that you can wire up through when you're in there. But it allows you to manually transduce with the tubing that comes in your central line kit. And essentially what you're doing here is connecting the tubing to the end of your micropuncture sheath and holding it up and seeing how far the blood comes up the tubing, essentially giving you a poor man's CVP. If you have a pulsatile arterial flow, it'll shoot out the top. and you know that you're in an artery and you shouldn't dilate up. And with a 4 or 5 French sheath, you're still way below the 7 French that gets concerning about taking the line out of the artery. Now, you can do that with what you see here, which is the little sheath that goes over your secondary needle. But this is only about 6 centimeters long. And so, if you've got an IJ that's very close to the surface, this might work. But as you get much deeper vessels in the groin and the subclavian, it's much harder to use this to capture the vessel to then transduce. So using a micropuncture kit and capturing the vessel now allows you to make sure that you're in a vein. And once I've manually transduced to confirm I'm in a vein, I now can rewire my micropuncture kit. So put my actual real central line wire through the kit, take out my micropuncture, and do my central line as I normally would. It gives me an added degree of safety that you don't have normally. And finally, the wire. Now, the wire is as special as it's small. It's actually got a pretty stiff back to it, and then the tip is floppy. And so this allows you to have a straight tip wire without concerning of going through the vessel wall, because it's very floppy, so it won't actually get through when it hits the vessel wall. Whereas the J-tip wire is pretty stiff all the way to the end. That's why they have to curve it so it doesn't poke through the wall. Again, what a straight tip wire allows you to do is fit into spaces that the J-tip will just get kinked. So all those vessels that are collapsing on you, that you have to take a pretty steep curve to go around, because you have to, because of the patient's anatomy, take a very steep angle. This allows you to get through those spaces much safer, capture that vessel with a wire, put your micropuncture in, and then wire up through that. How this looks on a patient, I'm going to capture the vessel initially much like I normally do with the central line, meaning I identify the vessel on ultrasound, then I'm going to walk in with my needle, only this is a 21 gauge micropuncture needle, so it's much smaller. Now, you notice here that we're not putting a syringe at the end of this. This is a really key feature when you're using a micropuncture, because it shows up so nicely on ultrasound and because you have so much control. What you're going to do with this is you're just going to hold your needle. I like to put my finger over the top and hold it like this. But what you're going to do is you're going to actually just identify when your needle gets into the vessel on ultrasound and not use your flash as your feedback. And that allows you to have much more control over your needle rather than being all the way back at the end of the syringe, where even small movements change the distal tip of your needle by a lot. Gives you a much added benefit of control. And as long as you get very good at following your needle tip, this is a perfectly safe technique. You capture the vessel, or you get into the vessel with your needle. Now you're going to thread your micropuncture wire through the catheter, capture the vessel with that wire. The next thing you do is you're going to take your needle out and you're going to put your micropuncture, introduce your sheath over the top. And all you're going to do is just walk it over. And again, you don't need to dilate, pre-dilate, or pre-nick. You can just push this all the way through. It goes in really nicely. It's a beautiful dilator. Once you've captured the vessel with your micropuncture, you're going to take out both the wire and the built-in dilator. And now you have captured the vessel with a 4 or a 5 French catheter, right? And at this point, you can do two things. First, you manually transduce, as we talked about, to confirm that you're in a vein. And now, once you're in there, you can wire up with your normal central line wire, the J-tip wire that you normally get, and you're going to take your micropuncture out and you're going to go on with the procedure just like you would normally. This, again, gives you an added level of safety to protect these patients that you can manually transduce. All right, so a couple things that I think is worth noting. So this is, we're going to put a central line in a patient. You can see I've got the micropuncture wire, and you can see that it's a little curved on the front, and that comes just from storage of it. Sometimes they're not stored correctly, so they get a little bent, and that can cause this issue where you're trying to push the wires into the needle and you can't. It can be a little bit frustrating. And so the way you solve that is I just hold a little pressure and I just rotate it a little bit. So all I'm doing is hold the pressure at the tip and rotating it, and it'll pop into place, and then I'm going to push on as normal. The next thing you show here that you're seeing is, you see how far back on the wire I'm grabbing before I am pushing it in through the actual needle? I want to ensure by the time my hand reaches the needle the wires out the front. And this allows me to capture the vessel in one push. With the micropuncture wire, because it has such a floppy tip, it tends to be very back heavy, and people have a tendency to grab it close to the front because they think they can control it more. And as they're trying to put it into the needle, it falls back out. And so you usually fumble if you do that. So you want to make sure you grab it far enough back that as you capture the vessel, as your hand hits the needle, you've captured the vessel in the front, like you see in that video. Finally, the last tip that you should probably think about is make sure the micropuncture catheter that you're putting in, so 4 or 5 French, is smaller than the end catheter that will be sitting in that vessel. So example, if you're putting in a 5 French micropuncture and then you're putting in a standard triple lumen central line, which is typically 7 or 8 French, that's okay, because the hole that you made in that vessel with the micropuncture is going to be smaller than the hole you're inevitably going to make with the catheter. So it won't bleed around the catheter. Most of the time, this is not an issue. Most of the time, you're going to have end catheters that are larger than the micropuncture. The only time to consider this is if you're putting in a femoral arterial line and you're using a very small catheter, something like a 20 gauge, a 5 French can be slightly larger than that. And so you might get some bleeding around the inevitable catheter because you dilated a hole in the artery that's slightly bigger than that. Most of the time, that's not a big deal, but it can be somewhat of a problem. So I always ensure 2 things when I'm putting in the femoral art lines. I like using the 4 French micropuncture kit because, again, that's just a smaller catheter. And I make sure that I put in a slightly larger catheter, like an 18 gauge single lumen central line kit or an 18 gauge arterial kit. That way I can ensure that I'm not going to be bleeding around the micropuncture itself. All right, so this was a micropuncture kit. Again, you all have these at your hospitals. You just have to find them. And I would really encourage people to start using them. It seems like an extra step at first, but when you start using one, you just find it so much easier to actually do central lines, to have so much more control of your needle, to much more easily get in the vessels with a micropuncture wire. And when you can start using them, you find all kinds of little tricks and hints with these things that you can do. Anytime you bend a wire as you're putting in the central line, you can throw your micropuncture catheter over, recapture that vessel with a micropuncture, pull out your bent wire, rewire with a fresh one. And so there's so many nice tips that you can use with these. And the best thing is they're already in your hospital. You just have to find them. So I encourage you all to take a look. Hopefully this becomes beneficial. And can't wait to hear all the stories that you guys have with your micropuncture kits.